infectious disease epidemiology course. And like I always do with 130, 140 undergrads, I said, who's interested in some extra credit? And of course, they all raised their hand. And I said, well, there's this strange virus in China, and we don't know much about it, and it'd be great to sort of talk about it. And, you know, at that time, I really think all of us, there isn't anyone in the US really who thought it was going to be more than there's this strange virus in China. And of course, the great news for the course was that these students learned, as I learned, how to do infectious disease epidemiology, or how to learn about a new virus and how to really think through when we don't have a lot of information, when evidence gets presented halfway through, how to evaluate all the different things that people are coming out with. But that was really it. And I have to say, and maybe some of you know this already, the following week, so this is the second week then of January, I had a call from the chancellor's office that he's put together, Howard's put together this task force, because they are concerned, what if it comes, we have very tight ties to Asia, what if it comes here, what are we gonna do, what about the school? And so from then on, and some of you may have been part of that task force, as you know, from then on, we have been, I think, living and breathing COVID. And yesterday we were out because the communities are so important. Public health was out working with Latino Health Access, and the mayor and the superintendents of schools in Santa Ana and Anaheim to do a youth summit, because we need to use our youth as ambassadors of health and information into these densely populated communities where there's a lot of coronavirus, a lot of COVID-19. And so just having that conversation again, and I said to them, you know, when you first come up, when we first get introduced to a virus like a COVID, obviously there's a lot of fear, and there's a lot of desire, really desire to do whatever it takes. We're in an acute phase, and I had done some work in Ebola a number of years ago and some other viruses. And so you have this acute, I'm gonna just do it, I'm gonna be disciplined, no one's getting out, everyone's sheltered in, and it's gonna be fine. It's gonna be fine, right? 2 weeks led to 3 weeks, led to 8 weeks, led to 12 weeks. And I said that at some point in the last maybe 3 or 4 weeks, there's been this change. And the change is, we're not in acute COVID anymore. We're really in chronic COVID, and it's a very different thing. And we are fatigued, all of us, every single one of us, you know, and all of you out there, we're tired. We're tired of doing all the things that we've done so well. And you know that if you look at the curves, you will find that when we sheltered in place, university first, county second, state third, in that mid-March area, we really did shift that trajectory. In early March, and I think you all know this, but I'll just repeat it, we were going at a rate growing. COVID was growing in Orange County at a rate, it was doubling every 3 days. And that was leading to a trajectory which was much like what we saw in Italy and what unfolded in New York. And we really did, you know, flatten that curve. And it isn't until you really look at mid to end May that you start to see those numbers going up. And of course, I think fatigue, anxiety, depression, anger. At some point about 9 weeks into this, I said to my husband, Bruce, I said, I can't imagine what it would be like to be sheltering in place with someone you don't like, you know, with a partner or spouse that, you know, you just don't get along with, in a household with domestic violence, in a household where there's a lot of food insecurity, and in a household where everyone wants to be protective of each other, but somebody really is out there being the essential worker, being the front-facing healthcare worker, and every day coming back and thinking, I hope I haven't brought anything in to this house. I've been so careful. So I think we are really fatigued, and so we are in this chronic phase. And you know, I don't know. I don't think Cynthia knows either. Nobody knows how long this is going to last. There isn't as much discussion of vaccines as there used to be. I think that's because some of the immunological issues around COVID are still being really looked at. There's conflicting findings. What is that COVID response? And so I think that's where we are. We are fluid, but we are tired. And so I'm going to shift the conversations that I'm having with people from preparedness and prevention to harm reduction, risk reduction. Because for some people, the need to get out and do something is almost desperate. And we want to be protective of ourselves, our family, of our community. We have to do what we can. It's very hard for each of us to know exactly what somebody else can or can't do, because we don't really know. So we have to just be out there saying, this is the right thing to do. This is the vigilance that we need to take. But should all give yourselves a pat on the back. And it's been a long, long journey. So I would say that was the week. The only other thing is I was out there today, so I think you all heard that as part of a large research grant with Orange County Healthcare Agency, we are indeed looking to understand the exposure of COVID in Orange County, and we're doing that through this randomized serosurveillance study. We're looking at antibody titers, high responsive titers versus no or low responsive titers, antibody titers to COVID. And so we're doing this at different sites throughout the county, making sure, and really this goes into what Cynthia is interested in and her whole life's work has been on. And ironically, I've been doing, most of my work has also been on disparities, but in cardiovascular disease specifically. But really, we're trying with this survey to understand the impact in all the communities of Orange County, not just one or two communities. So we are out there doing that. And we did that all day today. We'll do that all day tomorrow, and we'll continue to do that probably until mid-August.
So Bernadette, I just wanted to emphasize you've helped shine a spotlight on the health disparities in Orange County, particularly in regards to COVID. And we know that the rates of infection now are 4 to 6 times higher in communities such as Anaheim and Santa Ana as compared to Irvine. And I wonder if you can say a little more about why those rates are so much higher and what might be done to reduce those rates.
Yeah, that's a great question, Cynthia. And I think there's a lot of reasons and things that we don't know at the same time. So COVID starts out in Orange County as a disease of the wealthy. It probably came in initially through travel, whether it was airplane travel or cruise travel. And you see that the first few weeks of cases are South County and definitely associated with higher income, higher educational level. And then you see this shift into Santa Ana and Anaheim, really a real tremendous shift. And you see the virus really growing there. And Santa Ana and Anaheim are dense communities. And so there are more people that this virus can be spread to and can be spread in a rapid way. The number of people living in a household is greater. There's a lot. If you look at census tract level, and census tract are these geographic communities of about 2,500 people or more, and they're clustered, but they usually talk about the socio-demographics of the community. So the proportion of the community living below the poverty level, the proportion with college education. And there's an indicator, the proportion of people who can work from home. And in communities like Santa Ana and Anaheim, when everybody else was sheltering in place, those communities had less opportunity because of the nature of their jobs. They were front facing, they were essential workers. I think it took a little while for the businesses that were employing these front facing essential workers to provide masks, to provide places for them to wash their hands, to be vigilant. And so I think that was a problem. And so that's a second kind of issue. And so we get this high density, quick spread in those communities. And at the same time, we have a large Latinx population, a large Asian population in those communities. And we're actually we have a paper that's coming out, and it's on something called metabolic syndrome, which is just really a constellation of different risk factors. So hypertension or high blood pressure, diabetes, obesity, lipid dysfunction, all of these seem to be really very, very strongly associated, a six-fold risk of poor prognostic outcomes for COVID compared to people that don't have this. And there's this interesting dose response. Well, if you look at not just Orange County, but if you look at the way that race ethnic disparities have unfolded across the country, in New York, in Chicago, in Washington, in Atlanta, in Texas, and in Orange County, African American and Latinx populations are really bearing the burden of COVID. I mean, COVID is everywhere, but they are bearing a disproportionate burden of COVID, and they have also bore this disproportionate burden of risk factors associated with the metabolic syndrome. And it is, and I was very, very angry, I'm sure you were, Cynthia, when we started to see this. It is the perfect storm of, of poor outcomes for the very populations that have often been missed and have, have had, I guess, dysfunctional healthcare infrastructure. And then you have these chronic diseases, and then you have this infectious disease. So the last thing I want to just say about that, because I think, you can plot out these curves by education, by occupation, by income, and you see these great disparities. Even though the social policy that worked for us here in Orange County as a county, and that policy was to shelter in place, even that policy, and it was great because we got this flattening of the curve, was not really one that valued social determinants, because we should have thought, all of us should have thought about how we could apply that policy equally when circumstances were really not equal.
Well, I'll just emphasize that the people who are bearing the disproportionate risks for COVID and serious consequences of COVID are often working in the types of jobs that support the rest of us and enable us to do the things that we do more safely remotely, right? People who are working in agriculture, in the service industry, in the groceries, cleaning, working in yards and so forth. These are people who are essential workers to keep society running smoothly. They can't work remotely. They make our lives more comfortable and easy, but they put themselves at risk. And I'll just share a story. I was on call last week and I talked to a gentleman who had very classic symptoms of COVID. I said, I think you need to get a test. You need to quarantine yourself. And he said, well, do I need to go to a hotel? And I said, well, I'm not sure. I said, who's living in your home? So he had a 2-bedroom apartment where 8 people were living. And so obviously it's going to be very difficult for him to quarantine himself in a home with 8 people in a very small apartment. And so that's the type of people who are working so hard, one, to make a living for themselves, but also to support and make our lives comfortable. And so how do we ensure that they have the care and the support they need?
Bernadette, did you want to comment on that any further?
No, I mean, I think that's absolutely right. And I would just say that now, over the last few weeks, COVID is in the county. It's everywhere. And so, you know, we didn't see a lot of COVID in a lot of communities earlier because it just wasn't really there. And it is now everywhere in the county. And so we do really have, you know, we are in an emergency situation, as Cynthia has indicated.
Thank you. So one of our questions, we have an incredibly good group of questions, but some of the most relevant of you're just referring to is what's happening in Orange County with contact tracing. Are people being trained? Are people being hired? Or are they volunteering? The writer says that she knows people would be interested and capable of working on this project in University Hills. So I guess my 2 questions are where are we with testing with 3 million people in Orange County, and where are we with contact tracing?
So I'll start this and then Cynthia can take it. The testing, tracing, and isolation are really the key components to trying to get our arms around this virus. And, you know, we stumbled a bit, absolutely, in the beginning in terms of testing and testing access. We are in better shape in terms of testing than we were. I think there was 6,800 tests that they claim were done today. There are 1,251 positives that were reported. Remember, the testing done today and the positives are not linked. But what is really important is that we've had a cumulative rate, a cumulative number of COVID cases, about 23,000. Over, I don't even know where's my testing number, over 303,000 that have been tested. And so we're at a positive rate of COVID of about 8%. Now, March and April and most of May, that rate was about 4%. So we've doubled the rate of positive cases. We've also, of course, doubled our testing, but it's really the rate that's most important. And so that is one thing. The Orange County Healthcare Agency, as all healthcare agencies, with their responsibility for all reportable diseases, is a component of contact tracing. They, in the very beginning of COVID, they did not have enough contact tracers, certainly, to be able to handle this. They have hired more people. I think they've doubled the number of people, but it's nowhere sufficient for the type of numbers that we see for the 3.2 million people in Orange County. And so one of the things that we've worked with them on here at UCI is for them to deputize us at UCI to do our own contact tracing. And just for anyone who doesn't know, so contact tracing means that once a case is identified as positive, so the COVID test comes back positive, not the antibodies, the actual COVID active PCR test is positive, you're supposed to go and speak to that person and say, who are the people that you've been in direct contact with, defined now by public health and CDC as spending 15 minutes or more with you in your 6-foot space, basically, right? Or 6-foot space that we're supposed to have around us, our socially distanced space. And who are those people, and you know, that you've spent this time with over the last 2 weeks. And the contact tracer gets all that information and goes and speaks with all of those different people. And they are ordered to get a test themselves and isolate for 14 days. That's the concept of contact tracing. And we heard how successful it was in China, in South Korea. It is a very successful technique because you basically halt the virus, but that means a lot of people are home. And then, of course, remember that every person in that next grouping that tests positive, you need to then go and figure out who their contacts have been. And so, that's, let's call that the third generation out, they are isolated. And so you basically shut the virus down by stopping transmission. So we've spoken with Orange County Healthcare Agency, and I know a lot of you got this, and anyone who doesn't, we'll make sure that you can send this out. We have our own contact tracing training. It's remote. It starts on July 20th. It has all the technical components to how to do contact tracing, and it has a community lens. So we're working with our communities to do this. We are training health promotores in Santa Ana and Anaheim to do sort of a follow-up in contact tracing. And we have, as part of our plan for UCI, opening in a hybrid mode, okay, which is mostly remote, but some socially distanced small classes, especially for graduate students. We are training a workforce of a couple of hundred to do contact tracing. So anyone in the community that's interested in attending the course, and then, you know, we will work with the Orange County Healthcare Agency. I think they are going to need more help.
Deborah put a link for signing up for that, Bernadette, in the...
Great. That's great. Thanks so much.
That's terrific. And I really thank Bernadette and the program in public health for the contact tracing workshop and training that's about to launch. And let me just say that it's very delicate work because we have many people in our community who are undocumented, and they're quite fearful of sharing detailed information about their lives, their contacts, even where they're living, for fear of deportation. So we have this confluence of people who are living in fear because they're undocumented. We have the Black Lives Matter and discrimination against people of color who are being discriminated against. And now you have COVID layered on top of that. And so I think we are in the space of a very complex psychosocial phenomenon, as well as the fact that a number of people who are either testing positive and minimally symptomatic and very much needing to work to support themselves in order to eat and to feed their families. And so there's this challenge often and reluctance of sharing a lot of information because people are literally trying to determine whether they're going to be able to make a living and be able to eat, or perhaps be evicted from their homes, and or divulge information about COVID contacts. So it's a very delicate space. It's very important to do this respectfully and safely and with the greatest level of confidentiality as possible. I'll just share another story of a patient I saw in the clinic this week who, 50-year-old woman who is basically homeless, living on the streets. And had a lot of health problems, a lot of health issues. And I said, you know, I can't imagine how hard it must be sleeping on the streets and not having a place to live. Wouldn't you rather be in a shelter? And she said, no, because if I'm in a shelter, I can't look for a job because I'm going to be restricted. And so it's really important that I am out and about and trying to find work so that I can support myself to buy food. And so there are a lot of people in our community who are really facing these very complex challenges, you know, the virus, their own personal safety, and then the economic pressures of being able to have a job and make a living and buy food and have shelter.
Yeah, I mean, Cynthia, it's awful. I gave this lecture to a couple of hundred youth yesterday, and before and after the lecture, or you know, on COVID, because we want them to think like contact tracers. We you know, really explained, and we had these breakout sessions where they talked about what it was like living in their homes with COVID. And you know, people with young children, some of them were worried that if they reported their symptoms, that people were going to take their children away from them. You know, there's a huge amount of fear and distrust, and as you said, just really horrific, heartbreaking circumstances on top of, you know, that were already bad, and then we add this in. Somebody talked a little bit about contact tracing again in the chat, and I just want to add one other thing, which is that right now, if you go and have a test for COVID, depending upon where you go, it could take anywhere from a day to a couple of days to a week to get the result back. Now, that result, if it was positive, finds its way to the Orange County Healthcare Agency, where they put it in, and I'm going to go get this reversed, but I think where they put it into Cal Ready, and then it goes to Cal Connect. And only when it's in Cal Connect does that say, we have to send out a contact tracer. So right now, contact tracing is not effective because the time between testing positive and sending out a contact tracer can be a week. Can you imagine how much that virus has been transmitted? One of the things we want to do at UCI for our UCI community is the test will be, we'll have a knowledge of that test because we'll be doing the test here, and then we will prompt contact tracing immediately. The greater number of the people who have been positive, obviously, the harder it becomes to contact trace. We've had about 6,000 students living in our community on campus since March, students who had no home to go to, students who couldn't get home because they were perhaps in places that wouldn't let them back in. And now even people can't, you know, get back in to certain places around the globe. And we had basically no community spread of COVID. Students were in separate rooms. There were a minimum number of students that shared bathrooms, and we asked students to sort of live in this pod of a couple of students together. So we can still get control over this virus, but we're losing that each day that goes by. And so that's why there's all of these sort of multi-pronged approaches: increasing testing, getting very efficient at contact tracing, meaning other groups like UCI will take on its own workforce, making sure, to your point, Cynthia, that isolation is there. So if you're in the medical center, for example, and you have young children and you're working in the medical center and you are afraid that you have COVID or you have COVID, there are things that we are providing to make sure that people are isolated, and then getting these youth ambassadors out and really talking to their households and their networks about halting transmission. All of these things are important, and of course it has to come from the top down. And I think that's been very challenging here in Orange County.
That's a really good perspective. I think sometimes we in University Hills aren't looking out quite so much at what's going on in Orange County, or even enough. I know that we've all experienced the frustration of being in Orange County right now. But thank you, Cindy, for that perspective, and Bernadette for yours. How are the tracers being screened? That need for sensitivity, that need for a pretty high level of emotional intelligence. How are those screenings being done?
We are taking graduate students, College of Health Science, clinical students in public health, in nursing, in medicine, in pharmacy, and other students with and working with them. So the contact tracing workshop is just one component of that. There's pre and post. There are debriefings. There will be a supervisor for every 10 contact tracers, and they will rotate. It's not going to be a 9-to-5 job. We built a workforce that's large enough, and that with the debriefings that they will be able to get, they'll be able to take a deep breath, if you will. And we really are making sure that they're emotional. It's very good point that they have emotional support. And you should also know that as part of the contact tracing focus that the Vice Chancellor of Health, Steve Goldstein, has assembled an advisory group on COVID, who is working with all of the numbers here at the university as well as outside of the university, just to make sure that if we need to cool off, for example, if we need to shut things down for 2 weeks or 3 weeks, that we're ready to do that if we started to see large enough numbers. So there is this sort of system of checks and balances, a data safety and monitoring board, if for any of you who do, biomedical research, if you will.
Thank you, Bernadette. So there's 2 areas I think that are on a lot of people's minds around safety, and one is travel. The other is certainly parents and children going back to school, and what will happen, what can happen, what can't happen. Do you want to speak to either one of those things? For example, train travel or airplane travel?
I'm getting on a plane on August 1st. I have to go home to New York and rescue my furniture. So, it's interesting. In terms of plane travel, look, I think it's the time for everyone to be, not to be intermingling with large populations that you don't know. It's just not the time to be doing that. It really is the time to take a step back and be careful. But being careful, you can be careful. There's many people that are frontline workers with proper protective equipment, a mask, and making sure that they're washing their hands, sanitizing their hands, have been safe. The airplane itself, you can make safe, but so I will be just wearing my mask, taking many little mini bottles of hand sanitizer with me. Because as I bought my last big bottle, I thought, I don't think I can take this on the plane. It's too big. And I will not be eating the meal from California to New York. Not that that's a good meal to eat anyway. And I will be wearing gloves when I first get on, just making sure I've wiped everything down. And then when I get off, and then I will quarantine myself as I need to in New York, working remotely. So, I would say if you don't have to get on a plane, you should not get on a plane. But if you have to get on a plane, you can get on a plane and you can be safe. It's actually, in my opinion, all the stuff that goes on before you get on a plane and after you get off the plane, that's where we lose some control. Right? You know, we're tired. We've just been breathing in our masks for, you know, that 6-hour flight. We get off the plane and we let our guard down, and we shouldn't do that. We should continue to be vigilant, picking up the luggage, vigilant the whole way until, you know, you get to your safe place. And if it's a hotel, you know, a lot of hotels are committing now, or motels are committing to, you know, to leaving a room for 24 hours before they clean it, find out. I know the Marriott chains are committing to do that. So you have to do a little bit more legwork to figure that out. You know, the question for us was, is it safer to drive or safer to fly? And so to drive means that you're going to stop off at different motels, right? And you're going to be encountering a lot more in and out takeout through all different kinds of states. And, you know, as Cynthia will tell you, it's not so good for older people to be sitting in cars for 3 days. It does things like cause, you know, deep vein thrombosis and clots in the legs. And so there are other, remember, you know, it's not like the world stopped all other medical conditions because COVID's around. And so that's the other thing people really need to think about. So I would say that on travel, but I'm going to throw, I think, the biggest question that you asked, the most challenging question, over to Cynthia, and then I'll comment after. But it's school, right? It's not college. I think the colleges and universities have got a good sense. It's elementary school. So my personal story is my daughter is pregnant again. She has a 5-year-old and she's pregnant. So I'm very excited. She's a federal prosecutor in Washington. She's pregnant with her second. She has underlying, she has got some high risk conditions, and due in December, a COVID baby. And basically her OBGYN told her, you can't go out and your child should not go to school until you deliver. So, I mean, and that's, you know, from a COVID professional in Georgetown in Washington, okay? So we're hearing all of these different things. Are children super spreaders? Are they spreaders? Does it matter? They seem to be symptomatic, but it's who they're going home to. So Cynthia, over to you on that.
Well, this is a really tough challenge because on the one hand, we need our children to be able to go to school because it's so important for their cognitive and their psychosocial development. And at the same time, we know that the interactions at school could increase the risk of contracting and then transmitting COVID. The good news, the really good news, is that children are less likely to suffer the severe consequences of COVID, except those children that have underlying cardiopulmonary conditions. And so children are susceptible, but at a much lower rate than adults or the elderly in particular. But then the question comes, well, what about children as transmitters to teachers or to their family members when they come home, their grandparents and so forth? And that's the big question. There's a lot of unknowns in terms of children, in terms of their transmission rates. There's a lot of questions these days about asymptomatic transmission of COVID in general, that we know that there are some studies reported where in Italy, for example, where up to 40% of people in a community who tested positive were essentially asymptomatic. So we know that there's spread occurring, not just from children, but from others, adults who are asymptomatic. And so basically the more interaction you have, what I've told my residents and the junior doctors in our department is essentially every interaction you have with any other person could be a potential exposure. And it's really hard for us to know at this point because we don't have the testing capability. we don't know the transmission details as much as we would like. So in order for schools to open safely, there are a number of criteria that have been outlined by the CDC, and those criteria are pretty solid criteria. And I would say that basically very few school districts would be able to meet those criteria in terms of baseline numbers and in terms of surveillance and in terms of ability to follow through. So here in Orange County, I know there's intense debate going on even in the Irvine School District about whether and how schools will reopen in just a month or two. And I think there are many unknown variables that make it quite difficult for any parent or teacher to make a decision with confidence.
I can tell you that my daughter is a lawyer with California Charter School Association, and she has her work cut out for her working with the charter schools as well. I know one of those charter schools, Dan Cooper, is working with as a model, and that's with kids who are integrated into classrooms with severe disabilities. So that's sort of another end of the extreme. I know that Irvine Unified School District is moving. It's active and moving right now. Thank you for that. That's really helpful. I wonder if, I know we had a lot of questions that you answered without my asking them, without prompting you, and I appreciate that. I wonder if we can focus on the farmers market just for a minute. I think that's also a good example of thinking about the way that we are operating in the world a little differently now. And maybe we can answer Carol's question.
Well, let me just say it was a little bit of a thrill for me to see that the farmers market was open today. I did not go there, so I'm not really able to comment on the details of what measures have they implemented to really ensure physical distancing. Bernadette, I don't know if you've had a chance to take a look at that.
No, I haven't. It's really, right, we're really walking a fine line here, right? Because we do want to encourage economic, development, and we want to get our economy back on its feet. I just think that everyone needs to remain very vigilant. And so things, if you must go, try to go at a time when, you have minimum numbers of people. And I think that you need still to be out there making sure that you're comfortable, because as Cynthia said, everybody that you interact with is a potential transmitter of disease. You are too, we don't know. So we don't know who's the transmitter and the receiver because of these very mild symptoms, these asymptomatic cases. Mask. And I think, I watch people in the store. So I've got a lot of folks I see now wearing masks, but then I see a lot of touching face, masks, pulling it up, and then touching other things. And I know, we've been talking a lot about air droplets, but there's still a lot of touching that can transmit disease. And so you really have to be careful. This is not the time to let your guard down, because again, I think that we're seeing more COVID throughout the entire population. And what does it say on the chat?
Right. I think Michelle was at the farmers market this morning. Michelle, do you want to say a few words about that?
It was only my observations. Thanks. It was a surprise to us. We were expecting to stay in the car, and they do guide you to one sort of checkpoint where, no, they don't screen your temperature. They just say, please wear a mask. Everybody that I saw was wearing a mask, although there was one person approaching as I was leaving that wasn't, and she was filming an aggressive kind of move on her part. I don't know what happened with that. Beyond that, you really don't have any ways of, it's every person for themselves. People were either, it's like what you encounter walking down Newport Beach, for example, or Newport Beach, the city. Nothing I could really report that would be distinctive that could tell you. I would love maybe fevers to be checked, but beyond that.
You know, it's very frustrating. What do you say to somebody who's not wearing a mask, right? I mean, Nicole Quick is now, I think, in Wisconsin or heading that way because she had death threats for not wanting to remove the mandatory mask wearing. It's crazy that it has come to this. I think you have to turn around and be prepared and walk away. I remember, right, when you're raising children, there's something in one of those how to raise children when your child has a temper tantrum in the store, even if your grocery cart is almost full and you're waiting online at the checkout counter, you're supposed to say, I'm removing you, take them out and go. And I think we have to have the same kind. I mean, it's not worth getting into arguments. People have seen enough. They know. And yes, I think, Cynthia, to your point, some people are just disbelievers or they're fatigued or whatever it is. But at that point, best to protect yourself. Walk away.
Speaking of, we have a couple of private, questions that have come up through the course of this related to mask wearing, and we're sort of on that topic of schools anyway. But and now we're talking about farmers markets and other environments. But in general, where do you sit with, if every interaction is a potential to spread this, are we better off, for whether it's a school environment, in a classroom, and indoors for hours with other kids, or at a farmer's market, is this mask enough of a game changer that's the compromise? Like, if we could only just all wear masks, then we could go about things in a somewhat normal way, or is that not good enough? Must we revert to a true shelter in place, knock down the virus, and then move forward?
That's a great question. I think that a true shelter in place is not going to happen. I really will be surprised if people adhere to that. I think we should all try. Life is not normal, and we shouldn't be going out there like it is normal. But I do think the mask is very protective. And I think, again, mask plus being vigilant with hand washing. When you come home, strip your clothes off, throw them in the washer. What's the big deal? Change them. I think that is all worth it. And I think we can function, to some degree like that. Because people are just going to go crazy if they're going to go back sheltering in place. Is that the way that we could totally stop the transmission of the virus? Yes. But, we probably should have totally sheltered in place in March, as opposed to probably there was a reduction, I would say about 60% of activity, and it made a difference. But now we are here, and I think mask and gloves worn properly, being vigilant, and really try to, stay home as much as you can. Harm reduction, risk reduction. That's the way I would go, and that's how I would counsel.
Thank you. So we are 2 minutes to the hour, and I want to thank you all. Thank everyone who is here, who's been here, who's been listening, who's offered questions. I especially want to thank you, Cynthia and Bernadette. This is a wonderful perspective, and when we meet, I always think these things through during the course of the week, share with other people. So this has been a great service for us to our community, but also that perspective of what the greater county is struggling with, suffering through. It's important to see that. Thank you. Thank you both. Thank you all. Hobart, do you want to take us out?
Sure. I want to thank again, of course, Cindy and Bernadette. This has been really informative and lots of very, very valuable takeaways. And it's remarkable that we as a community, I'm thinking about the 6,000 people at UCI who were able to prevent a tremendous spread. The students deserve a tremendous pat on the back for doing what's necessary to keep us safe up on the hill. And we, in turn, have been doing things to keep each other safe. And we all ought to congratulate ourselves for doing that. It's really hard to keep going, but thank you everyone for doing it. As one of the people in the older generation who's more at risk, I really appreciate your efforts. We have a regular program coming up, I guess not next week, but 2 weeks from now. That's a plan, am I right, Dr. Hawk? Okay, great. And once again, go to uhills.org for information about other community events and other things that are going on that are truly informative. And the July 20th, the contact tracing training, we'll put information about that in the listserv and on the webpage so that you'll have an opportunity, if you want to be involved in that, to get that information. Thank you again, everyone.
Thank you, everyone. Thank you, Zach, for your support and help. Thank you. Good night.
Good night, everybody.
Good night.
Thank you.
Thank you. Bye-bye.
Bye-bye.